So here, when it comes to oncological tumors, brain tumors, benign or malignant, it is not that it's not rare. It happens in brains, but usually it is a rare occasion that it's malignant based on the first spot of origin. It's more likely that it could be metastasized. That doesn't mean that somebody couldn't get a spot on their brain and cause cancer. It's just a rare occasion when it does, because it's more of a source of traveling. Now, the primary tumors, when it comes to these patients, acoustic, angiomas, and then your metastasized tumors as a whole. Remember, tumors need a source of blood flow. They need a source of nutrition. So that angiomas are masses of abnormal blood cells. So that thing will grow and grow and grow. And then symptoms develop. The symptoms listed with clinical manifestation is already listed on there for you. We've already talked headaches, we talked vomiting, visual disturbances. Kind of plays a role in where possibly that tumor can be located. Hearing, more, and vertigo, more with the acoustic neuroma. Other assessments is what we've always assessed. LOC, getting questions about can they hear, can they see, anything neurologically associated with that patient. Common tumor sites, just the ones that we mentioned. Also shows you where they are. One thing, the acoustic neuroma sits on that acoustic vein, so that's where the hearing is associated with. So it really could happen anywhere, but common sites are common sites. That's where they tend to look at first, and then do a little dig deeper if they have to. Diagnostic, when they want to look at density, they might dig a little deeper into an MRI. Initially, it could be a CT, but they have to get more precise information. If there's any seizure activity, they will do the EEG. They could examine the cerebrospinal fluid as a whole. Biopsies may be needed. Medical management, just like with any cancers, are all going to be determined on the prognosis, what stage, what size, what extent, is there lymph node involvement. All of that stuff that we've already talked about, cancer-related, is the same here. Whether it's radiation, do they have to have surgery to remove it? And then it goes back to the increased intracranial pressure we have to monitor. Okay? Spinal cord tumors. Again, weakness, pain goes along with that. Surgical removal. And dexamethasone then for spinal cord tumors is the actual steroid of choice when it comes to the tumor-related patient with spinal cord injury caused by a spinal cord tumor. It would be dexamethasone as the steroid of choice. Unlike the injury was our Solu-Medrol. Okay? Questions? Questions? I'm pretty sure this